Did you know that October is my favorite month? No? Good. Then I can tell you why. Because of all the horror and the scary movies. I love it. And you know what's so scary about it? That they all have that main character, the villain, that you just honestly cannot wrap your brain around how they can do what they're doing. Like, it scares you because it's so out of normality and just anything that you would ever experience in your life. Which goes along with the disorder that I picked, antisocial personality disorder. Antisocial personality disorder is one of the most puzzling disorders that doctors and clinicians see in the practice and field. This disorder previously has been comprised of people characterizing and failing to fit in with the social norms of society, which is exactly like the psychopaths in your favorite horror movie. This disorder falls under the category of cluster B personality disorders. People that are diagnosed with this under this personality disorders category are known to be erratic, dramatic, and highly emotional. Antisocial personality disorder tends to make people irresponsible, impulsive, and deceitful, which makes people known as social predators. They'll just go through people's lives and manipulate them for their own gain, and they'll leave a trail of destruction, whether it's emotional, sometimes physical, and financial, to everyone that's in their way. People with this disorder have a lack of guilt or conscience or empathy. They feel nothing for doing these violations, and all they focus on is pleasing themselves, which makes it extremely easy for them to do it because they don't feel bad for anything. And if I didn't feel bad for doing stuff, I would probably do it all the time. Let's be honest. They violate the rights of others and are often viewed as being aggressive because they do what they want regardless of the concerns of others. About 60% of them have used drugs at some point or the other. It also has a lifelong pattern of these people, and because the long-term outcome for people is so great, most of them end up homeless or extremely financially poor because they are unable to keep a job because of impulsivity. Through several psychiatrists, they've narrowed down a checklist as an assessment tool, and the Clerk Hare kind of combined them for 6 descriptive characteristics. They are superficial charm, pathological lying, lack of remorse, grandiose sense of self-worth, manipulative, and lack of empathy. The Clark Hare checklist focuses primarily on personality traits. Now, earlier versions of the DSM criteria, antisocial personality disorder, focus almost entirely on observable behaviors that resemble impulsivity and repeated changes in employment, residences, or sexual partners. The previous DSM framers believed that trying to assess a person's personalities traits would be more difficult than recognizing certain behaviors because that's more feasible. Identifying psychopaths among criminal populations seems to have implications of predicting their future criminal behavior. As you can imagine, having a lack of a sense of remorse or guilt for doing things would make it really difficult for someone to stay out of trouble with the law or legal system. Prevalence, roughly 2.1% of adults, or you could put 1 in 47, are diagnosed with antisocial personality disorder. It usually begins as conduct disorder as a child, but that's early onset would be childhood or adolescence, but it has a lifelong duration. And it's much more prevalent in men than women. They think that that's because men already have a natural sense of aggressiveness and just impulsivity than women do. They're more logical, like thinkers and emotional before they do things, as where men are more, let's take action and charge. So they think that's why it's much more prevalent in men. The DSM-5, the current criteria, it describes it as a persuasive pattern of disregard for and of the violation of rights of others. And it occurs since the age of 15 and is indicated by 3 or more of the following of the list. So there's failure to conform to social norms. So they don't really look at the laws and the rules of society as they apply to them. They do as they please. Number 2 is deceitfulness. So they'll have repeated lying, use of aliases. They con other people for pleasure or gain, personal gain. They have impulsivity or failure to plan ahead. Irritability or aggressiveness, that's number 4. Number 5 is a reckless disregard to self or others. They have consistent irresponsibility, so they can't keep a job, they float around a lot, and they have a lack of remorse. Another criteria is they have to at least be 18 years of age before you can diagnose someone with this disorder. Evidence of onset before age of 15. So it has to be consistent and it has to be before the age of 15. So during childhood and adolescence, they have to show signs of this conduct disorder. And there are many genetic influences of this. They did a study where they took adopted children and they took them from incarcerated women and then normal women that were the mothers, and they took them as soon as they were born, so to limit any environmental factors that could be into their lives and how they live. And the children that came from the incarcerated women had a much more significant amount of criminal activity compared to those that came from normal women. And the theory is, as this genetic influence is considered an endophenotype, which means it's a gene that causes a genetic influence on a person's personalities. And it's the cause for the unusual aspects of anti-personality disorder. Researchers are particularly looking at the different influences of serotonin and dopamine levels, which result in a lack of anxiety or fear that are the same that are seen in anti-personality disorder. They aren't looking for a gene or a particular thing that causes the disorder, but they look at the genes that cause the same personality traits as the disorder. Okay, there are two main theories for this. One is the underarousal theory. It's the abnormally low levels of cortical arousal characteristics of antisocial and risk-taking behaviors. They have chronically low levels of arousal. So in one study that they read, basically the sense of arousal and satisfaction that we would get from a phone call from a good friend, they wouldn't feel anything with that. They wouldn't feel that level until they took drugs or were on some kind of substance that would lift up their arousal levels. The study also shows that they tested for future criminals, and they had lower skin conductance activity, a lower heart rate at rest periods, and a more slow frequency of brainwave activity. So they're all aspects of low arousal. Another one is the fearlessness theory. These individuals have a higher threshold for experiencing fear than most people. So what most people would find very, very fearful and dangerous and things that they just completely stay away from, the people with antisocial personality disorder, they wouldn't really find it as scary. They might find it as scary as like a spider on your wall. Many therapists have applied Jeffrey Gray's model of brain functioning to this population of people. According to Gray, we have three major brain systems. There is the BIS, or the behavioral inhibition system, the reward system, and the fight or flight system. And two of these apply for people with anti-personality disorder. The behavioral inhibition system is responsible for our ability to stop and slow down when we're faced with an impending punishment. So anything that leads to like anxiety or frustration or anything that might cause fear. And the reward system is responsible for how we behave in a particular way towards positive rewards or things that would cause hope or relief. It's other known as a pleasure pathway. And what they're looking at with anti-personality disorder is an imbalance between these two that make fear and anxiety produced in the BIS less apparent, and the positive feelings from the reward system more prevalent. So one major problem with treating people in this group is they rarely identify themselves as having a problem. And when you don't think you have a problem, you really can't be helped. You have to admit you have a problem before you can really see any kind of positive and truthful results. Many clinicians are pessimistic about it because a lot of people with this disorder can just con them and lie to them into believing that their treatment has worked when really it hasn't. They're just doing what they need to get out so they can do what they want to again. In general, therapists agree that these people, once they hit adulthood and they have that lifestyle of this disorder, that they should be incarcerated to deter harm from occurring to others. And one large study did find that cognitive behavioral theory could reduce the likelihood of violence in like 5 years after treatment. So that is one treatment that they use for this. The most common treatment strategy for children that could become people with antisocial personality disorder involves parent training, and this is the most prominent treatment for people with antisocial personality disorders. So parents are taught to recognize behavioral problems early and how to use praise and privileges to reduce the problem behaviors, and more focus on them on pro-social behaviors to improve children as they grow into adulthood. Given the ineffectiveness of children for adults, prevention may be the best approach for this problem. Thank you.